your host today. For this session of the dialogue series, which has been thoughtfully crafted to serve as a dynamic platform for real-time global knowledge exchange, the theme that we have chosen is child-responsive urban policies and planning. Kerala Urban Dialogues aims to stimulate debates on crucial topics that are instrumental in reshaping Kerala's urban landscape. As we gather here virtually, we are joined by a very diverse group of experts, practitioners, and concerned citizens. Sorry about that. So today's theme, as I just mentioned, is child-responsive urban policies and planning, and it holds great significance. And we'll see exactly why. Given the global trend in urbanization, there is a significant potential to engage with children in the decisions that affect their physical urban environment, their interaction with the urban resource systems, and shaping their behavior. As Kerala continues to urbanize at a very rapid pace, managing urban landscapes that prioritize mental health, well-being, and participation of children becomes an increasingly complex challenge without coherent urban planning. Before we proceed to the main session, I would like to extend a very warm welcome to secretaries and senior officials from LSTD Kerala, mayors, corporation secretaries, chairpersons, and elected representatives of the urban local bodies. I extend my welcome to directors and representatives of national academic institutions and our global policy partners. We are very fortunate to have with us today Mr. Thomas George, Global Lead for Urban UNICEF, as the key speaker to share his insights on shaping urbanization for children and to present his concepts, evidence, and strategies to bring children to the forefront of urban planning. Thank you, sir, for dedicating your precious time to join us today. Joining us as discussants, we have two esteemed guests to add depth and practicality to our discussion through their first-hand experiences. First, we have Dr. Gayatri Menon, who is a designer educator at National Institute of Design. Welcome, madam. Our second discussant, Mr. Abhimanyu Prakash, is a senior program manager and regional lead from Global Designing Cities Initiative, GDCI, which is one of the world's most influential urban design organizations. A very warm welcome to you too, sir. Special welcome to Dr. Joy Elleman, Director General KILA, whose vision and leadership has been instrumental in shaping KILA's novel initiatives towards sustainable urban development. Next, I would also like to welcome Urban Chair Professor Dr. Ajit Kalir, who will be convening the discussion on behalf of our director. Moving to today's discussion, we have planned it as a panel discussion, which will be followed by a Q&A session. Participants may avail the Zoom chat box to raise questions during the discussion. And as we proceed to the main session, kindly ensure that your microphone is muted. Thank you. I'll just repeat the same in Malayalam. ഇന്നത്തെ ചർച്ച ഇംഗ്ലീഷിലായിരിക്കും പുരോഗമിക്കുന്നത്. ചർച്ചയുടെ സാരാംശം മലയാളത്തിൽ പിന്നീട് നൽകുന്നതായിരിക്കും. Now, before we begin our first session, let me briefly introduce our panelists. Our key speaker, Mr. Thomas George, is an experienced civilian development manager and professional in the area of urban development and local governance and child rights programming, with a demonstrated history of working in the non-profit organization management industry. He is currently UNICEF's Global Lead for Urban and has over 35 years of experience in international development, with 30 years working with the United Nations in different countries. He started his career with the Indian Civil Services and is skilled in advocacy and public policy analysis. Today, he will be discussing the importance of public spaces for fostering children's play and the role of cities in supporting the same. Over to you, sir.
Ajit, do you want to say something or should I start?
Yeah, in the interest of your time, let's have you first. And I'll come later once before we summarize. It will be better because you have some pressing commitments. Thank you.
I can be here till about, for another hour, I can be here, no problem. Yeah. So, thank you, Irene, Joy, Ajit, and other colleagues in KILA, and all other participants, especially Abhimanyu and Dr. Gayatri. Very Good morning from here in New York. I think it's quite late for you in Kerala and the rest of India. So thanks for agreeing to come this late for this presentation or this dialogue. And in line with the word dialogue, I'm not going to give a big speech or anything. I would like to keep it as a dialogue. I'm going to throw a few ideas, few concepts, few numbers into this discussion, and then we can have an interaction based on that. You can ask your questions in Malayalam or English, but mostly my replies would be more in English because I find it difficult to sometimes, articulate these professional thoughts in Malayalam. So bear with me. Starting with the global situation of urbanization, I don't think I need to stress here that we are a fast urbanizing world. We are already 57% urban, and soon by 2050 we'll be 68%. So roughly about 3/4 of the global population will be living in urban areas, which essentially means another 2 billion people will move into urban areas in the next 24, 25, 26 years. What's also most concerning is that this rapid urbanization in most parts of the world are unplanned and unregulated. So that's the cause for concern for us. And this rapid urbanization is happening because of three reasons. One is the births in the urban areas. The second one, the biggest one, in my opinion, is migration, either forced or aspirational migration. And many people also migrate to urban areas for anonymity. Here, I think we need to take note of the fact that 61% of refugees and 80% of internally displaced people are living in urban areas. And, a lot of urban areas will also be added to the world because of the reclassification. Couple of days back, I heard a UN Habitat presentation which said that in the next 40 years, double the land area of urban will be added to the world. So it's currently about 2% or 3% of the world's land surface is urban. It will be about 6 or 7%. This is what I heard. In this 57% or 4.56 billion people, almost 1 billion plus live in slums or slum households. And that's something which, as planners, we need to take note of. And this 1 billion, mostly is 80% of them are in Asia, South Asia, and Africa, Sub-Saharan Africa. So this is the general, scenario of urban and urbanization in terms of numbers. Now coming to children, there are 1.2 billion children living in urban areas globally now. But what is more concerning for us is that almost 500 million or 500 million of them are children who live in slums or informal settlements. In any city you take, 30 to 50% of the population, urban population, will be children. And when I say children, I go by the CRC definition of 0 to 18. I think people in Kerala know that by now. So depending on the context, it's 20 to 50%. In most developing countries, it's closer to 50% than 20%, I would say. But in Kerala, it could be anywhere between 30 or 35%. The growth of secondary cities, or towns as we call it in India, are also very fast, and you can't say that there is a general trend everywhere. Some big metropolitan cities are growing very fast, but if you look at Africa and all, most of the urbanization is happening in the secondary cities, and secondary cities are soon becoming bigger cities. If you look at the life in urban areas or in cities, I might use urban and cities interchangeably. We can say that children are impacted quite differently than adults, and children are impacted more. And I would like to base my discussion in going forward under three areas. One is safety, one is services, and one is a sustainable environment. And I will start with safety. Safety, when I talk about safety, I'm talking about safety from violence and other such behavior, and also safety from injuries. And security is also part of that. So children's safety in urban areas can be compromised in very different ways and very unique ways. It could be exploitative labor, living and working on the street, unsafe infrastructure. I think it's very common in developing countries, vehicular traffic, overcrowding, unsafe passage to school, and in some parts of the world, armed violence, criminal gang activity, and unsafe public spaces. So safety is a big issue that we should be talking about when we are talking about about children in cities. Here, children with disabilities face additional unique protection risks and are more likely to be exploited into working or begging on the street, making them more prone to violence, assault, victimization, child labor, and trafficking. When you talk about children with disabilities, you should also be mindful of the fact that they are not able to navigate most of the urban spaces if additional protection or additional measures are not taken for them. In some parts of the world, armed violence has reached crisis proportions in many urban hotspots, and the violence and urban environment interaction is quite unique. There is evidence both of cities changing where the violence occurs and of urban planning or the lack of it influencing urban violence. When you see the explosive weapons in populated areas, they are usually linked to urban warfare. And when explosive weapons are used in urban warfare, 91% of casualties are civilians, while children represent a large population. Sorry. In the past few weeks, we have been hearing a lot of news around this from the Middle East, and there, if I remember correctly, 40% of the civilian population affected are children. So safety is one, and you can go on and on discussing about safety, but I'll just put this into your onto the table and then move on to the next one, which is services, access to services. There is a general feeling that children in urban areas have better access to services, that children, gain benefit from an urban advantage. But if you drill deeper into the data, you will find that it's not an urban advantage for all children, but it's an urban paradox for many children. So UNICEF did an analysis of 71 countries in 2018. That's available on the website. And we found that children from the poorest quintile in urban areas, that means the bottom 25% of children, were twice as likely to die before their 5th birthday compared to the children from the richest quintile. So the under 5 mortality was double for children in the lowest quintile compared to the children in the highest quintile. Recent data from UN Habitat also shows that I talked about 1.2 billion children living in urban areas, and out of that, 500 million are children living in slums. The under 5 mortality in slums is 53, whereas in the non-slums in globally is only 38. So there is 38, almost 16 points difference in the the mortality itself. More recent data on zero-dose children. I don't know whether you are aware of the concept of zero-dose. Zero-dose children are children who have not had any vaccination at all. Again, when you talk about zero-dose children, the tendency is to look for such children in remote rural areas. But if you analyze the latest data, only 11% of zero-dose children are in remote rural areas, whereas 28% live in urban and peri-urban areas. But what is more interesting or shocking is that 40% of the zero-dose children are in urban outgrowths, areas which are already urbanized, but they are still deemed rural. In some cities, there are areas which are just outside the urban areas, which are growing at 20% on an annual basis. So these are areas where the children are there who are not have had any access to the immunization services. Which means that almost 70% of children who are zero dose live in urban, peri-urban, and urban outgrowths. Now, you must be wondering why I'm stressing more on zero dose children. Zero dose is considered as the best proxy for the children and their families' access to any services. If a children has not been reached by the health worker, then the chances of the children being reached by any other services is very minimal. So this shows that access to services is a major issue for the poorest people who live in urban areas. Then after services, I would like to move on to the sustainable environment bit. Start with the climate change. We now know that more than 70% of the cities are already dealing with the effects of climate change, and nearly all cities are at risk. Climate change is a threat multiplier, disproportionately affecting the most vulnerable. Mostly the slums and informal settlements are in low-lying areas. Poor people live in areas which get flooded very fast. They live in houses made of material which is not climate friendly, and so on and so forth. Much of the world's population live in coastal cities and in slums and informal that are usually situated at the edges of cities and low-lying areas. Rising global temperatures causes sea levels to rise, increasing the number of extreme weather events such as floods, droughts, and storms, and increase the spread of tropical diseases. In Asian coastal cities, extreme heat is a growing problem, and so is the problem of epidemics. I don't know how many of you know that in the first year of COVID, more than 90% of the cases were reported from urban areas and cities. So unplanned urban expansion is a key driver of environmental degradation and risk, and children in urban areas are also exposed to environmental pollutants in air, water, and soil. Industrial growth and urbanization contribute to air pollution, which affects more than 90% of children around the world. And children living in urban areas are also exposed to a broad range of toxic metals and chemicals due to improper household, industrial, and electronic waste management and disposal, and hospital waste incineration. So the high child mortality and morbidity among children living in slums can be attributed to the living conditions, which are worsened by urban waste and the severely inadequate disposal systems. So if you look at the numbers, industrial waste, 570,000 children under 5 die from respiratory infections. Municipal solid waste, children who are waste pickers or reside in proximity to landfill sites and waste-producing industries such as slaughterhouses, animal farms, and tanneries are at particular risk. Construction and biomedical waste, driven injury, electronic waste. So waste or municipal waste disposal is a major area which impacts children and their well-being. When it comes to the correlation between the vulnerability of the most disadvantaged children and the built environment, there's a strong correlation there. And an unsustainable built environment constrains children access to urban services, leads to urban-specific environmental health problems, and shifts the focus from communicable to non-communicable diseases, which health support systems cannot address alone. The built environment also influences to what extent children's participation is possible in terms of public spaces where children can congregate and other infrastructure that allows for their physical, social, and digital connectivity. In this discussion, I would like to stress on the need for clean, green, safe public spaces for children. And the quality and the safety of public spaces influence many aspects of children's lives, their physical and mental health, skills and social relationships, their citizenship, all that. So WHO has said that access to child-friendly neighborhoods provides children with the opportunity to play and exercise outdoors, and they list green spaces among the social determinants of health of children. So access to neighborhood facilities for play and leisure is a key environmental dimension that can impact children's well-being. So you might have all read about the UN General Assembly passing a resolution in 2022, that was last year, recognizing the human right to a clean, healthy, and sustainable environment. So in line with that, the Committee on the Rights of the Child, in its general comments on children's rights and the environment in September, a couple of months back, says that a clean, healthy, and sustainable environment is both a human rights itself and necessary for the full enjoyment of a broad range of children's rights. States must ensure a clean, healthy, and sustainable environment in order to respect, protect, and fulfill children's rights. State must take deliberate, specific, and targeted steps towards achieving the full and effective enjoyment of children's rights related to the environment, including the right to a healthy environment, including through the development of legislation, policies, strategies, or plans. It's a very strong general comment from the Committee on the Rights of the Child, which has come out just 2 months back. Finally, in a city, when you're talking about child well-being, you cannot not touch on the governance issues. There are several governance constraints when it comes to urban governance. The urban settings are large areas, complex, fragmented, and have people from different ethnic, linguistic, and socioeconomically diverse groups living side by side. Even within a large urban settings, there could be multiple contexts, from highly developed city centers to slums and informal settlements. Several actors are involved in delivering infrastructure, utilities, and services. You cannot not discount the role of private sector and other actors in even providing services and infrastructure. There is even a trend of private companies developing cities. I believe there are already 15 cities which are developed by private companies where the city is governed not by a mayor, but by a CEO. Excuse me. So multiplicity of actors, and most often the accountability of city governments or who is accountable for services or planning is not very clear, very ambiguous, sometimes overlapping jurisdictions. With the 74th Amendment in India and in Kerala, there are 4 levels of governance when it comes to a city or urban. You have the national, you have state, you have the district and the municipal body. And in town panchayats, I don't know whether town panchayats still exist in Kerala, but if there are town panchayats, then that's an additional 5th layer there. So the gist of it is that the governance in urban is quite complex and complicated, and it needs the coordination between various actors to make sense of it. So our push for safe, inclusive, and sustainable cities for children stems from the assumption that a city fit for all is a city fit for children is a city fit for all. So that's the argument we push for. But of late, I've been thinking that there might be a few additional things needed for geriatric care in cities, in on top of what you plan for children. So mainstreaming the rights of children in urban policies and legislation, as well as in urban planning standards and activities, is the primary step to building these more inclusive, sustainable, and safe cities for children. In this context, I have listed a few areas that need to be priority areas in the urban policies. Urban policies are usually about land use, spatial infrastructure, and so on. But for child well-being, what we suggest and we promote is that there should be a clear program framework for children with clear indicators included into the national urban policies and other related policies. A lot of work has been done globally on this. The urban monitoring framework has been developed by UN Habitat and various other agencies. It's been approved by the Statistical Commission. And in India, especially the urban outcome framework is there with, I think they have something like 351 odd indicators. And UNICEF has also worked with the National Institute of Urban Administration and other partners to embed a basket of child-related indicators into the urban outcomes framework. That could be a good starting point, and Kerala might, while working on this, maybe be able to improve on the indicator framework and make use of that in the urban policy. The second one, so the first one is on program framework for children. Second one is on provision of intra-urban data and evidence. Sorry. So as we said, the city averages mask huge inequities, and city might not be homogeneous. Different parts of the city might have different characteristics. So intra-urban data and evidence is crucial for planning for cities. Evidence in the sense of both quantitative and qualitative. If you look at the bottlenecks of service delivery or planning or safety, the bottlenecks might be different in different parts of the city. In the state, it might be different for different sets of cities. Tier 1 towns might have one problem, Tier 2 towns might have another problem. So that evidence of what actually is the local issue. The third one is the capacities of cities for evidence-based planning, budgeting, including disaster risk reduction and response. As we said, city governments might not be the strongest layer of government in many countries, and how to increase their capacity and both horizontal and vertical coordination between the different actors. Added to that is the clear accountabilities and coordination for implementation of services because of the multiplicity of actors in cities, which we have discussed earlier. Child responsive urban planning standards for which explicitly address issues of safety, equity, and sustainable environment for children and infrastructure for child services. Whether there are adequate spaces kept aside for child-related services, and also definitely public spaces, including streets. One area which has not been in the child rights discourse so far is children's right to housing. And in the right to housing discourse also, child rights is not there. And housing is a key prerequisite for safety, for services, and for a sustainable environment for children. So children's right to adequate housing has to be there forcefully. And norms and regulations for addressing issues of pollutants and waste management. I know that the state is grappling with the issue of waste management. So how can that be incorporated fully into the urban policy, and also argued from an angle of child rights there. last but not the least is the whole area of child participation and participation of poor communities into urban governance. This is an area which needs to be institutionalized, and probably in India, Kerala is the state where the maximum initiatives are there for child participation in governance. I don't know. I mean, I've not worked in Kerala in the last 10 years, so I don't know how far it has gone now. But in the rural areas, probably it's a lot more advanced and developed, and in the urban areas, we have to have institutionalized mechanisms for child and community participation. For all this, also we need to bring in the concept of financing. Where does the financing come from? Is it intergovernmental transfers? Is it cities' own revenues? It's the municipalities, leveraging funds from somewhere else, private sector, whatever. Financing is again something which has to be looked at for making sure that all these areas are covered. So these are the thoughts which I have to start the discussion. As I said before, UNICEF feels that a city fit for children is a city fit for all, and you have to work at different levels for results for children. It can't be a top-down approach. It cannot be a bottom-up approach. It has to be both, working with different layers of government to make this a reality. So thank you for inviting me and allowing me to share my thoughts, and happy to work with you on making this a reality. Over. Over from my side.
Thank you, sir, for your wonderful presentation, giving us an overview of the various challenges, urbanization process, and stressing stressing the fact that shaping urbanization for children not only will benefit children but also current and future citizens. Now, I would like to invite Dr. Gayatri Menon to take up the discussion from here. Dr. Gayatri is a principal faculty at National Institute of Design, Ahmedabad, with nearly 25 years of experience in design education, research, and practice. Currently, she is the activity chairperson, research and development, and head of Center of Teaching and Learning at NID Ahmedabad. Her areas of work include system design, design thinking, creativity, and innovation. And she has been a board member of ITRA, International Toy Research Association, and a part of the expert committee set up to introduce creativity and design in the schools like NCERT. Now let's hear from her about the take on this. Over to you, ma'am.
Yeah, thank you. And also thanks for the background given by Mr. George. Sorry about my voice. Yeah, I'm very happy to be here for two reasons. Let me explain why. One is because it is to do with children, and I'm very happy that, children often get a backstage, and here, they are the center stage, and that's very nice, It shows the priority which is given to children. And the other reason is that it is about policies. So often when we talk about design and innovation, we think about products. Yeah, and almost 2 decades back, I started shifting from products to processes and services, because I felt products alone cannot work, and you need processes and services to back it up, and you need systems and organizations at a macro level along with that. Yeah, and lastly, in the last 2-3 years, I've been realizing the importance of policy, because a lot of things which happen on ground are determined by policies. And early this year, I presented a paper on how to design policies, or one of the perspectives which I had based on my experience on, approach to design policies. So there you have various types of models, like you have binary models where you're trying to say, what is good and what is bad, and you encourage the good through the policy, or you have a linear process of policy making. What I had proposed also was that along with this top-down approach of policy making, one should also have a bottoms-up approach where we have more participatory methods, where we innovate things when we try and understand from children, from communities, and based on that, we come up with ideas, and these ideas can then give a direction to what sort of policies will enable us to actually make or realize these ideas. Yeah, so that was broadly what I was talking about. And when we talk about children, actually, my journey started almost 25, 26 years back when I was doing my final year project on designing play material for mentally challenged children, which was sponsored by UNESCO German Commission. It also gave me an opportunity to visit various centers across India and also across the world. Yeah, and it also showed me the disparity, the economic disparity largely between various contexts globally. Yeah, and one also realizes that when we are talking about mentally challenged children, they don't have a voice. Yeah, this is one community which doesn't have a voice. And how can innovation enable them, yeah, to realize their full potential? And as such, if we talk about children, the objective could be to help them realize their full potential through whatever we do. Yeah, whether it is through the basic things of giving them safety or security, but beyond that, also ensure that, in terms of their cognitive development, emotional development, socio-cultural development, yeah, they're able to realize their full potential. And that is where perhaps, the whole public design thing becomes very important, because we see that there is also a disparity in terms of the school education which children receive, yeah, based on which strata of society they come from. Yeah, and that means that we are actually not realizing the potential of children across the various stratas, and children of today are the future of tomorrow. Yeah, so what we give to children today will determine the type of future or the type of society which we are building in the future. And that is why we need to pay attention that, we create a more equitable society. And for that, whether it is public systems of education or public spaces or public play areas or public community areas, these things should get a priority over, looking at private initiatives. Yeah, because we can then be more inclusive in our approaches. 2 weeks back, I was in Hungary for a social design innovation conference. And as part of the conference, apart from the paper, we also had a workshop. So the workshop which I chose to be a part of actually worked with Ukrainian children who had come over there. They were war refugees and they were staying there. And in such a warlike situation, the children get the least priority, their education gets the least priority. Yeah. So how do you take care of, the psychological trauma? How do you take care of their future, their education, the community spirit, and also the difference of language? So how can these children get integrated into the mainstream society? So when I was sort of discussing these areas in the workshop, I suddenly also realized that India is so heterogeneous and diverse that it is almost like, having so many multiple mini countries within the nation of India. Yeah, children from different states who may have come there as their parents may have come there as migrant laborers would probably face not the trauma, but they would also face a situation of how to fit in with the other children. Yeah, the language disparities, yeah, the bullying which often happens in school. So how do you ensure that that these can be minimized, or how do you bring people together? So some of these public space initiatives, public design initiatives could also take care of these aspects. And one thing which we felt could really work was play. Yeah, because like creativity and imagination, play is something which is a instinct in human being. You don't have to teach anyone to play. You are born with the instinct to play with things around you. Yeah, and children more so. So play as a medium, play as a language, which can bridge the disparity, can also be a very interesting medium. So when we work with children, you cannot lecture children. Yeah, neither can you say that, you need to do this only. But the minute you have resources and infrastructure which gives an enabling environment for them to come together, play together, that itself becomes a language for them to interact with each other and get over the differences. Yeah, so we also need to creatively imagine, play could be one example, but we also need to creatively imagine that what are the mediums through which we can bring these diverse people together. Also, when we are talking about children, it is not necessary that children only play with children. We realize that when we talk about elderly people, for example, children often interact very closely with elderly people in public spaces. It's just that they don't get an opportunity to do so. Yeah. So how do you also, this is in one of the, I had visited Baba Amte's place, and over there they had Anandvan, and they had this very beautiful initiative where they had the orphanage and they had the place for elderly right opposite to each other, and in between was a garden. Yeah, so the garden was a common space where the old age people, elderly people living in the old age home and the children living in orphanage could meet and, you know, interact with each other, and then they can also go back to their own spaces. But we need this sort of meeting spaces where we could have community interactions, yeah, across ages, across economic backgrounds, and which is where, you know, these sort of enabling environments could play a very major role. Yeah. So again, one of the most key challenges is how do we understand people? So if we start from that, most of us have our own bias when we are trying to create something new based on our own experiences. So how do we go beyond those, our own personal experiences, and try to understand things from their point of view? Yeah, and which is where these sort of participatory approaches to understanding people through action, not just through verbal medium, not just through observation, but actually through action, through experiments. Yeah, this could be a very interesting way in which we can understand where they come from and come up with actual infrastructure and come up with models. You know, one can have experimental models which are created together by people, and this could give an indication as to what sort of planning and what sort of thought process and what sort of approaches we would need to think of in order to sort of realize some of these ideas. Lastly, I would also want to agree with this whole thing about SDGs, because they are very important when we are talking about sustainability, not just in terms of environmental sustainability, where we are talking about climate change and the effects of it, but also in terms of economic and socio-cultural aspects of sustainability. And we find that, you know, there are issues and concerns related to all three. Yeah, we already talked about the economic disparity, but so is true about the socio-cultural and emotional aspects of, you know, how do we deal with these issues. Children today, because of our education system, are becoming too competitive in nature, yeah, which also makes them isolated. And because of this competitive nature, you also find a breakdown of, you know, there is no one, there is a lot of social media, but social media friends, I would say, but less of actual friends who form a support group for them when they actually need people. So in this age of digitization, in this age of competition, how do we also help them to build that community spirit? How do we help them to build those emotional linkages, yeah, which would actually help them to anchor themselves in where they are and make them more self-confident and strong, both, you know, emotionally. And so this is another aspect, and this, I believe, should start with children. Like, you know, Maria Montessori says that you cannot be competitive, you know, in your childhood and suddenly expect that when they grow up as adults, they'll suddenly become cooperative, friendly individuals. Yeah, it has to start right from the beginning, where they understand what it means to work in a team, what it means to be together, yeah, and not only think about yourself. So some of these factors, there could be many like this, but some of these factors are also very important to instill in children right in that age. And which is where, again, you know, if we do it as a public space initiative, one would be able to see the results of it later. Again, when we are talking about socio-cultural and especially the cultural aspect of it, are we really respecting the diversity, or somewhere are we trying to become more homogeneous? So in a way, we have a whole YouTube generation, and I have actually found many children who speak English in a very American accent, and it sometimes feel very odd. And they also speak the regional languages in that accent. So how do we actually, how do we also respect the diversity which we have and come together while respecting that diversity and while also promoting that culture? Yeah, so and that is something which we are very rich in India, and that is something also which needs to be encouraged. So if we look at socio-cultural, the environmental aspect, and the ecological and the economic aspect, I think we'll be able to come up with more sustainable designs through a more participatory bottoms-up approach while working closely with children in a more action-oriented way. So that's it for now.
Thank you, ma'am, for taking us through some of the very innovative ways through which we make extreme on children's voices, and for highlighting the need to develop spaces and built environments that prioritize the needs of our children. Now, I would like to invite our second discussant, Mr. Abhinandan Prakash, to share his thoughts now. I'll introduce our discussant. Mr. Abhinandan Prakash is a senior manager at Global Designing Cities Initiatives, working with cities on the streets and public space design around the world through Bloomsburg Initiative for Global Road Safety. He was part of the core team developing the award-winning Global Street Design Guide. Various multi-scalar projects across German and Indian contexts have helped him to improve hone skills across scales and gain a holistic approach to urban design. Now, over to you, sir.
Thank you so much, and a very warm hello to everyone joining from different parts of the world. A big thank you to Mr. George for setting the context, for sharing the data, and giving us the challenge that we have at hand, as well as for Dr. Menon to share some examples and strategies which have been applied in different parts of the world. But as Irene mentioned in my bio, a lot of the work that I do and come from as part of the Global Designing Cities initiative is focused on one of the urban aspects, which is streets. But when I say one of the aspects, we consider it to be a tool or a gateway to many answers to the problems which have been listed down today. And before we start, I think something which Mr. George mentioned a couple of times through his talk was about creating cities for children, which are cities then for everyone. And I think it goes back to one of the mottos that we also like to re-emphasize in the cities that we're working on, is to shift from a reactive to a proactive approach. Yes, it is important to address the challenges of today and the immediate needs, but we also need to set a vision. And I think that is very important. Are cities setting the vision to be a child-friendly city? Are they setting a vision for tomorrow and what they want to be? And when we talk about visions, what is the vision which makes a city or an urban environment child-friendly? And to start with that, it's about making our cities safe and comfortable and accessible for our children, followed by cities which are healthy and comfortable for them. And finally, as Dr. Menon also started to talk about, it's important that these cities are also inspirational, educational, and playful. We know that urban areas are getting even more denser by the day all across the world. We heard from Mr. George about how many of these kids are staying in slums. Creating playgrounds, adding schools, adding new homes, infrastructure is difficult. It takes time, it takes a lot of money, a lot of planning, and a lot of stakeholders coming together. But one thing which we know that exists in our cities is streets. And we like to rethink how these streets can be looked at as public space. If we were to take a bird's eye view or a Google Earth view of a city, we can unlock the potential to see that streets are actually the largest network of continuous public space that exists in our city. And for decades, we have spent time to address them only as conduits for movement. But these streets in many parts of the world have been used for play, for learning, for congregation, for gathering, for enjoyment, entertainment, and for the growth and development of many, many communities. They used to be the lifeblood of our communities here in India for years and centuries. But today, our streets are just mere conduits of movement for large metal boxes, cars, right? And Mr. George listed that there is a very large number of people dying on our streets all around the world. But it is also important to note that a very large share of this is children, and actually road fatalities and injuries is the number one cause of deaths amongst the age group 5 to 29. In a country like India, where we talk about having a large youth population, the largest workforce, in changing our economies of today, if we're not able to save them, people, road crashes and fatalities, where is the workforce going? And apart from that, the way we design our streets and our urban environments also impact the life and death of these children in many more ways than just crashes. We know that urban air pollution kills over 4 million people prematurely every single year. And again, a very large number of being children, because we know that the amount of air that a child can breathe is much higher than that of an adult. And so urban air pollution affects them very, very greatly. Pollutants from cars, the level at which a smog pipe exits a car, it's at the level of a child breathing that in. We have eliminated active mobility from our cities, from our streets. People are walking lesser and lesser. People are cycling lesser and lesser than before. And as a result of this, over 40 million people are dying because of chronic diseases. And active lifestyles are a very big part of it. We just heard Dr. Menon talk about building in habits, right? Just the way competitive habits cannot be changed very easily with a child. If a child is not made to have an active lifestyle from the very get-go, if the city is not designed to promote walking and cycling, we can't expect those habits to be built over time, or those health lifestyle changes to come into over time. And which is why I feel we urge a lot of city government stakeholders, individuals, as well as groups of people to come together and rethink the way they're shaping their streets, because streets can truly unlock the potential for not just a great quality of life, but to provide these children with mobility and access, with environmental sustainability, and above all, equity. I'm talking about this and the stakeholders. We heard about the different levels of bureaucracy coming in, but another layer to this is the horizontal layers, which all go into shaping our streets. And it is very important that dialogues like this, being organized by Kila, as well as all of us in our day-to-day work, try to break the silos. Because we know that urban environments cannot be shaped by one single agency. If we were to take just a sidewalk in any one of our Indian cities, the right of way is managed by the transport department. The sewage underneath the sidewalk is done by the drainage. The lighting is by a different department. The trees are planted by the landscape department. The benches are placed by someone else, and the building facades are developed by someone else. And if we're not all working together we can never shape a holistic and a complete street or a complete city environment which is responsible and responsive to our children's needs and the needs of their caregivers. And the reason for caregivers is very important in this because even they are getting impacted. And their health is as much important because they're the ones who are going to be making sure that a lot of these children are getting access to these pieces. A recent study found that there were air pollutants found even in the placenta of unborn babies in urban environments, right? And that's how deep the problem is today, which we need to be solving, which we need to be working towards. But we're also seeing a lot of positive shift. We at the Global Designing Cities Initiative tend to work with city governments through the lens of road safety, through the lens of cycling, through the lens of children. And one common theme that is emerging in city governments in Asia, Latin America, Africa, and all the emerging economies is that everyone is ready to commit to something towards the improvement of life for children. And I think that's a huge, huge positive that we're seeing this mindset shift where political will is starting to exist. And I think we all need to shift the way we think to think from the 95 centimeter to design for the 95 centimeter, the average height of a child. And just to do that, one of the tools, and I can drop in the link in the chat room, we at the Global Designing Cities Initiative have been sharing a urban periscope, a tool which allows adults like all of us on the call to actually see through a mirror what a child experiences a city at 95 centimeters at their height. And as part of every project, every process that we take or we work with cities, we encourage them to first experience the site as a child and then design for them. Right. So I'm going to stop there just by ending on the note that we need to think like them to be able to design for them, to be able to experience like the children.
Thank you, sir, for a fantastic presentation, brilliantly highlighting the interconnectedness of our streets with the ways of the systems, and emphasizing how well-designed streets benefits cities and its residents equally. I would like to invite Dr. Rajiv for his closing remarks.
Yeah, thank you, Erin. I'm sorry, Thomas George and Professor Gayatri as well as Abhimanyu. I had a very unstable internet today, so it threw me out a couple of times. But I think at least 60% of your deliberations I could participate and I could hear. So thank you for joining us at a short notice. We haven't got anyone putting in any questions in the chat, but I'm sure there will be people who want to ask some questions. So hopefully there's another 15-20 minutes. Mr. Thomas, you will be able to be here for, yeah. So, okay. So Irene, we can open it up for questions. And then before we close, I will summarize with some of my observations and key points that I picked up.
Ajit, can you hear me?
Yeah, Umaji, yes, please go ahead. Can you speak a little louder? It's not very clear to us.
Yeah, I have an observation, not exactly a question. I want to add a point to Mr. George's and Dr. Gayatri's observations. This is about being very, very careful with the national or local policies on housing that impact children tremendously. To give an example, in 2001, the government of India came out with a draft national housing policy. Fortunately, it never saw the light of the day as a final policy. This policy actually mentions that slums are a form of housing, and you just regularize them, and that will solve most of the problem of the nation. So people will add as per their own ability to improve housing. And schools that exist within slums today can become formal schools, etc. There was a great danger in this kind of approach to not only equity for population in general, but it could be extremely dangerous for children who will be living in a inadequate house, have access to very little infrastructure, physical and social, and be condemned for the rest of their lives in working in environments, first studying in schools that are totally substandard, unlike the schools that we go to or our children go to, and subsequently probably end up working in slums and be condemned even in the working environment. So I think it is very important when we are trying to address through policy a solution to housing, we actually create situation of no escape for children. Similarly, no matter how much we discuss about children's benefit in terms of spatial planning, not only policy, but spatial planning, I think a great neighborhood plan, apart from addressing these issues at city scale or national scale, a good neighborhood plan is the most important aspect where a child benefits substantially. A child and the parents of the child or guardians of the child also benefit from giving access to the child to amenities from where they can be watched, from where they can be procured easily. So things within walking distance, that is from your house, access to a school, access to a playground, access to general amenities, other recreational facilities, and a job. Job seems to be far more difficult to achieve, but the rest of the things can be created as part of a good neighborhood plan. I think those will go a long way in creating safe environment for children and their healthy growth. So that's what I wanted to add. Thank you.
Thank you, Umaji. Sorry, I should have requested you to introduce yourself. So, for Mr. Thomas George as well as other speakers, Uma Adusumilli retired as a chief planner from the MMRD, Mumbai Metropolitan Region Development Authority. She has spent more than 30 years within the government, and also currently she chairs the TOD policy committee at the national level. And she is an active professional still contributing to various discourses. If anybody wants to respond, then we can have, otherwise we can listen to. Would any of you like to respond?
Hello.
I can.
Can you?
Sorry.
Hello.
Yeah, please. Sir, can you please introduce yourself briefly?
So yes, who you are. Myself, Abdul Rasaq from School of Planning and Architecture, is retired professor from the Department of Planning. I just have only just to supplement some of the views expressed by Thomas George and Dr. Gayatri Menon and Prakash. See, what my experience from the in the topic of child and cities, and also I gone through the various attempts internationally, nationally happening in terms of child-friendly cities ideas. But in my experience from the neighborhood level, what Uma Madam was talking about, designing a neighborhood, our conventional planning standards and norms look at the child as a numerical value. So we will see that how many percentage of the children, then we will see that, okay, every 1,000 population, we need to have a playground, parks and like that. But when I do a lot of research in Delhi and find out the toddlers, when we design for children, which is more, convincing to take up the people living in smaller neighborhood with low income colonies, where it is a missing element. But at the same time, it is seen universally, the high income areas, the toddlers are not used as a place for children, but otherwise it is present in the high income areas, but not in the low income areas. Where the child population is more, they need to have a space beyond their houses. But what I observed in middle and high income areas, the toddlers are used for parking, and which is no more, it is used for children for their livelihood, health and high physical and mental activities of it. So that is one aspect I'm thinking we have to revisit to look at neighborhood planning in terms of the standards and codes. So we see that how it can be related to the need of the different level of income groups, where it is more can be in the low income, middle income areas, and it can be less in the high income areas, which we cannot standardize that according to the number, which has a numerical value. Then the children should be seen as a human value. And second point is, as we know that many of the cities are having large section of the population in rural, in slum areas, when more children are there. But obviously, the slums are also part of the city where you have residential neighborhoods of planned colonies. But the main infrastructure pipeline is moving into the road, and the next area where the slum areas are not connected with the infrastructure. The access to drinking water and other facilities are not available, where we can see that there's a disparity in terms of providing infrastructure to the population who belongs to these low-income areas, where the population is having more in terms of child population also, where how we can spatially integrate the infrastructure facilities irrespective of the location, but it can be as per the need for the society who is living in that area. So this is something which I am thinking is that we have to think about how planning can be as a tool for facilitating the child population towards a better living in urban residential neighborhoods. Thank you, Ajit.
Okay, thank you. Can I also just, because there is Professor Bijan, I saw her here. She's from CET, and she and her team has been doing some work in Thiruvananthapuram. Bijan, would you like to intervene briefly? Something that you were trying to do in Thiruvananthapuram? Okay, I think she's probably on mute or she's not around. So if there are any quick responses from Thomas George, I'm mindful that he has to leave. He said he will leave in an hour. So would you want to quickly respond? I mean, there are observations. What both Professor Abdul Razak and Umaji mentioned are observations. But in case if you would like to come back and share your perspective, then we could.
No, thanks. I'll start with housing. Thanks to Umaji and Razak Saab for raising it. I think, I don't know whether there is a definition of what is adequate housing. There is a definition of what is slum housing and what is whatever is not there is non-slum housing. And I don't know whether this slum housing definition, a global definition, which is there from UN Habitat, can be applied everywhere. Maybe, Ajit, a good starting point for us in Kerala is to define what is adequate housing in the context of Kerala. It might be a bit complex, but I think that's a good starting point. I don't know, I can find out from China if they have something similar, because I was in a couple of meetings in China on urban planning standards for children, and they have worked out, like in a child development center, something like a nice CDS center, what should be the ventilation, the airflow, the light inside the room, and they have gone into that kind of specifics. They might have some definition for adequate housing, but we should maybe attempt a definition of what is adequate housing for children, and that I think will be a global. It'll be the first state to do that globally. We have, with the Habitat for Humanity and UN Habitat, developed a paper on children's right to housing. I can share that with you, but we have not gone into specifics of what is adequate housing. That's one. Umaji, thanks for pointing out that we have to look at a children's well-being or child well-being at 3 levels in a city: housing level, neighborhood level, and city level. Very, very important. And I think it's at the neighborhood level that where you bring in the housing and the public spaces together, and it becomes seamless. There are various concepts that children has to. If I am not mistaken, the SDG indicator is that there should be a public space available within 400 meters of the child's housing, and only 30% of the global population have access to public space within 400 meters. And this whole thing about public spaces is also not understood the same by different sets of people. For some people, public spaces is only playgrounds and parks, or but the fact is that streets are also public spaces. And thanks, Abhimanyu, for making that point. Here again, I can share this with you that UNICEF, along with UN Habitat and WHO, we're working on principles and guidance for children in public spaces, and that should be ready in a couple of months' time. A fairly good first draft is kind of emerged there, and we'll be able to share that with you. And Abhimanyu, if you're working on streets, I will be happy to get your inputs on that as well. The third point I wanted to stress here is, when we are talking about whether it's adequate housing or public spaces, very crucial point is how do you ensure child participation in that? One thing I have against this Urban 95 project is it kind of reduces all children to 0 to 6. Whereas when you're looking at children, you're looking at 0 to 18. And the different age groups and have different needs. Different genders have different, like public spaces. We know that even when public spaces are available, it's monopolized by adolescent boys, pushing younger children and girls out of the public space. So how do you ensure that all age groups can enjoy the public space which is there, and how can we ensure child participation, bringing in children of different age groups, different gender, disabled children, and children of minorities living in the neighborhoods also into that. So, thanks.
Thank you. I think this is certainly going to. Yeah, is there anyone who wanted to respond?
We have a question
yes.
in YouTube for Thomas, sir.
Go ahead,
What is
Irene.
the question?
Yeah. So the question is, are there any studies that investigates the correlation between urban density and children's safety?
Not that I'm aware of. I'm not aware of any studies, and safety, like I've lived in Bangladesh where there are more than 200,000, there are areas where more than 200,000 children live in more than 200,000 people live in 1 square kilometer. And children's safety is like maybe like any other Indian city, where you can walk across some cities in South America where in the slums you are not allowed to enter because it's unsafe. So I don't know whether density definitely might add to the lack of safety, but I wouldn't know whether there is any correlation between density and safety.
Does Abhimanyu or Gayatri, would any of you want to just quickly respond to this? Any? Abhimanyu also probably.
So I wanted to jump in actually just before the question, not on the density and safety correlation piece, but just the point which was raised by a couple of folks on neighborhood level plans, right? And I wanted to bring the topic to two terms which in the urban design world are gaining a lot of momentum and discussion. And I think we need to bring in children into that conversation. One is the 15-minute city. right? We've been hearing about the 15-minute city in every single conversation, whether it's in India or globally. And all these conversations are again talking about mobility. They're talking about access to services. They're talking about public space. But if you look at them by and large, none of these conversations are focusing on children, or very few are focusing on children. And I think that's a very important lens that we, all of us on this call and others, can spread to bring that big stakeholder group into what does the 15-minute city mean for children versus adults, right? Is 15 minutes, which can be traversed by you and me, is it same for an 18-year-old, as Mr. George said, and an 8-year-old, or is it different, right? What does that 15-minute look like for them? That's one piece. And the other is, one of the poster children of these kind of developments we often look to is the super blocks in Barcelona. And I think there is lots to learn and pick from that, where these super blocks in Barcelona create these environments which are safe, which are accessible, healthy, and comfortable for people of all ages and abilities. I think earlier Dr. Menon had mentioned about children with disabilities as well, being an important stakeholder to be considered. And I think there's lots to learn from that. But of course, here, coming back to Kerala as well as in India at large, I think we need to go back to our older settlements, our cities. And when I say older, I'm not talking about centuries ago, just a few decades ago. We can also go back to our rural environments for inspiration, where our cities, our neighborhoods were very mixed used in nature. Jane Jacobs, a big thought leader in our space, often talks about eyes on the street. We talk about safety. One aspect is, could density mean cities are more unsafe for children? On the contrary, going by Jane Jacobs, you would say, oh, density means more eyes on the street, which means more safety actually for our children, right? And I think we can start looking at a lot of these aspects, going back to how our settlements were, how our streets were, kind of the lifeblood in our neighborhoods, and see how that affects the safety for our children.
Yeah. I also feel that a lot of these aspects are contextual in nature. Yes, I was just thinking when, like, Abhimanyu was also talking about this, that in rural areas, we have seen that you have communities living together. And the minute you sort of come to metros and urban areas, then you have people from different communities, very diverse communities and groups staying together. And that whole neighborhood spirit is not there often, right? So in spite of living together as neighbors, the culture of neighborhood, or being friendly and feeling a part of the community, that is lacking. So how do we actually initiate that? Also, if we talk about whether it is due to climatic conditions or due to the cultural aspects, there are cities which are very active, which means people like to be in public spaces. Yeah, like if you look at old Ahmedabad, for example, it's one of the best examples of how people, there is a very narrow boundary between private and public spaces. There are people who are washing clothes on the road, right? There are people who are gathering under a tree. Yeah, and this happens in urban area, but in the old part of the city, because they've continued the tradition from decades. So this division between private and public space is always not so clear in many of the Indian cities. And there must be some sort of cultural behavior patterns which may result into people actually wanting to spend time together in common areas willingly, and building linkages and network with each other, which may be lacking in certain areas where public spaces are seen more as transactional or functional and not experiential and active. So this may be something else to look at. So I think it will be very good to look at it specifically for the context of Kerala. And one could actually come out with something very nuanced and something which is appropriate for that particular context.
Yes, thank you. Irene, are there any questions? Otherwise, we can probably start closing and we'll just summarize and close. This, I think, are there any questions? Can you see?
Ajit,
In the
sorry,
sorry.
go ahead. Go ahead.
Nothing in the Zoom chat box.
Okay.
If any of you want to ask first,
Okay.
unmute and ask.
Can I just add something?
Yeah, Professor Priyanjali, please go ahead.
I'm from College of Engineering, Trivandrum. We conducted some studies of children with disabilities sometime back. So we had interacted with many of the parents of the children. So many of them were from the middle income or lower middle income backgrounds. So one important thing which we found was that the children, it is very difficult to manage the children. And most of the children like to play outside. So, but it was not possible for the parents to take the children every day to some play area because first of all, there were not much play areas around. Only at the city level or maybe larger playgrounds are available and they require some kind of transport to take the children. If the child is using a wheelchair, very difficult for the parent to take the child to the play area. Or if they are taken to the play area also, they are not very comfortable there because children with disabilities are often not there. So definitely it is very important for children with disabilities to have play areas more because most of them are not going to school also if mobility issues are there and mental children who are mentally challenged. So they are usually homeschooled also. So this is one very important aspect which can be done by the local authorities, looked into by the local authorities, which can be done at least at local levels. They can open up some shared spaces for the children. So this is just one observation I was having. Thank you.
Great. No, this is very relevant. So the ideas of parklets and community spaces are all slowly gaining some momentum. I think if all of you agree, we can probably just summarize and close. Do we have 2 more minutes, Thomas? Yeah. Okay. So I'll quickly summarize the key points, and let me also tell you why we thought of inviting 3 of you together, because one is to get the global perspective from UNICEF, from Thomas, who heads the urban team at UNICEF, and looking at children and their challenges. And then 2 different perspectives. Gayatri's work I have followed a bit, where she tried to kind of mainstream play and play opportunities. So such opportunities in spaces, particularly when Kerala is rapidly urbanizing, we are realizing that these spaces are slowly getting eliminated, and more children are compelled to kind of use very minimal spaces to develop their peer relationship, to kind of meet their requirements, to be physically active. So a lot of them are slowly withdrawing to internal spaces, spending a lot of time in front of screens, and also reducing their social engagements. Recently, we did a short survey of the college-going students in Thrissur. About 15,000 are there, and very shockingly, we realized 40% of them are not at all active through any social activity. No clubs, no societies. They are not participating in anything. They are just stuck in their smaller spaces within the campuses or wherever. If we look at other cities, again, we might find similar kind of challenges. A lot of apartments are coming up in most of our cities, and these are just towers where very minimal social spaces are created. So there are new challenges coming up, and issues such as disengagement from the peers, disengagement with the family, disengagement with the society, and always just imagining of a better world and better time doesn't help anyone to really grow and evolve. So we wanted to kind of also trigger some discourse related to the play opportunities in cities when we look at in urban policy and for the state. how we can create such opportunities, how we can bring various stakeholders, whether it is CREDAI or Builders Association or Architects and Engineers Association, Indian Institute of Architects, urban designers and young professionals, academicians like Professor Priyanjali or many others who are some or the other way generating new evidences and kind of building that to kind of imagine an alternate future for Kerala's urbanization. And in the process, we also had an opportunity to engage with Abhimanyu's team. Thrissur actually got selected as one of the 20 cities around the world last year when Mayor of Thrissur applied for their Street for Kids Leadership Accelerator. Since then, we realized this idea of better streets, more safer and inclusive streets have also got into the imagination of the Honorable Mayor. I've heard it several times from the corporation meetings, Mayor and Council. Many of them keep thinking about how can we improve our roads and our streets, how we can make them much more safer, inclusive, and also create opportunities for children to come and use those spaces safely. So I think there is an emerging thinking around the world that while we reimagine our cities, plan our cities for greater efficiency, it is important that we also get the voices of the children, the next generation for whom these spaces are getting created. And as we work on this, the possibility of having a newly kind of digital urban policy for state, all these voices are important to be heard, and enough opportunities at various scales, at housing scale possibly, neighborhood scale, and also at city scale for children to come out and in large numbers have experience of the great outdoors, use it for play, use it for peer relationships, and also to feel that this is a space where we can meet and greet a lot of new people without getting into the risk. So I think we will have to appropriate the possibilities of density as we go forward. We will have to look at what are the appropriate density standards for various communities, depending upon the cultural, social ethos and other things. But I think there is a greater debate opening up, and we wanted to be to seize this opportunity and use it for shaping quality streets and public spaces, safe neighborhoods, and also eventually making our cities more livable, and possibly make our cities more family friendly. So children, elderly, all that we keep hearing these days about these discussions are, sometimes it used to be intergenerational, sometimes it used to be multi-generational, but we have to kind of understand family is the very basic unit of any democratic society. So we will have to kind of apply these ideas into that context, how families can come together safely in public spaces, in roads, and feel that these are our spaces, how we can use the evidences that are currently available. So very interestingly, Thomas George's points about the shift, the urban shift and need for a purposeful evidence-based approach to understand the challenges of children and use and generate meaningful solutions. Need for capacitating city authorities to understand these challenges and also to create just and equitable cities. His personal experience of working with the global urban monitoring framework and the learning from that, and how that can help in creating intra-urban evidences and data sets, promoting quality public spaces, calling out housing to be more inclusive of children's requirements. Certainly highlighting the challenges of housing and also financing, how we can also find new ways of funding these innovative solutions. Professor Gayatri's mentioned about our experiences from working with the mentally challenged children and many other groups which are traditionally getting sidelined in these debates, who have been voiceless. How do we mainstream their concerns and voices? How do we create more play opportunities? How do we help them to be team players? How do we instill the right values by creating public spaces, promoting some public space initiative, help them to respect diversity, cultural diversity, and creating adequate socio-cultural environments. Abhimanyu building on that by demanding streets being the most conducive and continuous network of public spaces across cities, it's important that these spaces are understood properly. They are not just for letting the cars or automobiles and metal boxes, what he called, to move around, but these should be also vibrant, safe, and inclusive spaces. There are quality inputs which have been brought by GDCI. So I think people who have listened to today's discussion, they will also be happy to kind of see the key works done by UNICEF, NID, and Professor Gayatri and others, and also Abhimanyu's and team's work focusing on cities and streets. And quality interventions by both Umaji as well as Professor Razak and now Professor Priyanjali, and other question about safety. And I think we have made a reasonably good beginning as we are going to work on in a new urban policy for Kerala to bring this debate into the forefront, and all of us would and should continuously engage on this to shape a relevant and very creatively produced new urban policy, giving children very center stage in this whole discourses. So I would like to formally thank Mr. Thomas George. It's just 4 days back we reached out to him and inquired whether he will be able to spend an hour for us. I've taken more than an hour. Sorry about it. Just had to kind of wind it up formally also. So thank you for agreeing to join at 8 a.m. New York time, and you spend almost 2 hours now with us. But yes, we would like to continue our engagement with you and UNICEF India team as well in developing some of these discourses. You have been a partner of our Kerala Urban Dialogue. So thank you, UNICEF and Professor and Mr. Thomas George, and Dr. Shaumin was also here. So all other colleagues from UNICEF for joining us and supporting us in this. Professor Gayatri Menon, again, 2-3 days back after Thomas George confirmed, I was looking for a person who could, contextualize this and kind of reflect and comment. So in the first message, she said, yes, I'm available, I can join. So thank you, Gayatri, for agreeing to be there. And we have been continuing some conversation since your last visit to Kila, and we want to mainstream some of this opportunity to make our public spaces and streets as more fun-filled rather than just dry and desolate and places where nobody wants to go and spend time. We will need your sustained support. And Abhimanyu, yes, the initiative we started with the GDCI's recognition of Thrissur. It has slowly helped us to open up our minds and helped us to kind of communicate these ideas to range of stakeholders who have been visiting Kila or within our network. And your willingness to partner with Kerala Urban Dialogue has furthered the opportunity. Many of the architecture, urban design, urban planning students and professionals and faculty members and professionals who are in this area, I'm sure they will also take note of many of the work that you and GDC has been contributing, and we look forward to work with all of you. So finally, just once again, thanking all of you, and we look forward to engaging more meaningfully again. Thank you.
Thank you.
Thank you. It was wonderful participating, and look forward to continued collaboration.
Thank you. So we'll bring it to a close now.
Yep.
Thank you. I'll connect all 3 of you over email so that you also know who all, and you can all continue the conversation. And whoever is interested to take,